Hello, my name is Brianna Herbalario, and I did my drug infomercial on caffeine. So, what is caffeine? Caffeine is a bitter substance that naturally occurs in over 60 plants, such as coffee beans, tea leaves, and etc. There's also a man made synthetic caffeine, which is added to some medicines, foods, and drinks. Caffeine can also be classified as a stimulant drug. An adult should only consume about 400 milligrams of caffeine per day, which basically equates to about 4 to 5 cups of coffee. So, where can caffeine be found? As I said before, caffeine could be found in coffee, tea, soda products, energy drinks, chocolate, and some medicines. So, about the amount of caffeine. So, about an 8-ounce cup of coffee equals to about 95 to 200 milligrams of caffeine. A 12-ounce can of soda equals about 35 to 45 milligrams of caffeine. An 8-ounce energy drink has about 70 to 100 milligrams. An 8-ounce cup of tea has about 14 to 60 milligrams of caffeine. And basically, when something says it's decaffeinated, it doesn't mean that there's no caffeine in it. It only means that it has less caffeine than it is in the normal amount. So as you can see on this photo, it just shows the amount of caffeine there is per cup. And so as you can see for decaf, it only has 3 milligrams of caffeine, as opposed to a full brewed coffee, which basically is 95 milligrams. So for the effects on the body, as caffeine is a stimulant drug, it basically stimulates the central nervous system. It's also classified as a diuretic, which basically means you'll urinate a lot. It also increases the release of acid in the stomach. It increases blood pressure, heart rate, and also alertness. And those are basically all classified as short-term effects. For the long-term effects, basically, if you have a regular heavy use of caffeine, it could lead to nervousness, insomnia, headaches, weakness and fatigue, muscle tremors, regular heart rates, low blood pressure, and poor appetite and even nausea. So for risks, there are a few risks of caffeine. Toxic effects can occur if an individual has a rapid consumption about 1,200 milligrams of caffeine. Also, there is something considered as pure concentrated caffeine. Basically, they come in pills or little powders, and 1 teaspoon of highly concentrated caffeine equals about 28 cups of coffee. Those individuals should avoid or limit caffeine if they are pregnant, since it could pose a risk for the fetus, as the caffeine could pass from the placenta to the fetus. Also, those with anxiety disorders, because since this is a stimulant drug, it could worsen the anxiety effects. Those who with sleep disorders or those with high blood pressure. Also, individuals that are taking certain medications or supplements should avoid caffeine, as it could complicate the effects of their medicine. There also is something as a withdrawal with caffeine. As everyone knows, if you have caffeine regularly but stop having caffeine, then you could have a withdrawal symptom. And those symptoms could include headaches, fatigue or drowsiness, a depressed mood, irritability, difficulty concentrating, or even flu-like symptoms. So there are some consequences with caffeine. If you mix caffeine with other drugs, it could have some complications. Caffeine with alcohol could have some major consequences, as the caffeine could cover up the effects of alcohol, such as sleeping. It could also interfere with the individual's ability to recognize how drunk they are, which could lead to binge drinking and increased risky behaviors. If you mix caffeine with other stimulant drugs, it could further increase the risk of cardiovascular issues. For college students and caffeine intake, it is showed in a study that 90% of university students reported to consuming caffeine at least once in the past year. 173 milligrams of caffeine per day were accounted for both men and for women. Most university students obtained their caffeine from coffee and tea, and then soon followed after was energy drinks and soda. College students are more likely to consume caffeine in order to enhance their mood or performance, to improve their concentration, increase physical energy, and alleviate stress. And these are my references. Thank you so much for listening, you guys.